Okay,
I
there I
can
can
hear me.
hear you
Oh,
now.
okay.
All
Oh,
right.
really? Thank you for waiting.
Oh, no,
I,
it's okay.
I thought you just went out because I had a technical problem, a
Uh-huh.
recurring problem. So I just turned off my computer and turned it on again. This,
Oh, oh, it was so good. I was quite worried because, is there like a problem? So
yeah, I had a.
oh, okay. But
Oh,
it's
so
good
thank
that
you.
you were able to log in. Okay. All right. So my name is Niza, and nice to meet you. How do I pronounce your name?
My name is Jihae.
Jiha.
Yes.
Oh, uh-huh. And Happy New Year to you, by the way.
Oh, thank you so much. You too.
So how's this year going for you? How were the 2 days, first 2 days of
Mm,
this year for you?
the first day, I mean, the end of the last year, I spent the night with my friend,
Mhm.
and for the following day, I spent with my family.
Oh.
Yes.
Uh-huh. All right. Do you usually celebrate Christmas Day and also Solar New Year's Day?
Oh yeah, sure. I had
Oh.
to.
Wow. All right. And what do you usually do to celebrate these holiday?
It depends. Like, if I have a boyfriend, I
Mhm.
usually spend the day with him. But
Mhm.
since I don't have now, I meet my friend, and
Mhm.
and you know, in those kind of days, every places are crowded with so many people. So now I just enjoy staying in my place or my friend's place and
Mhm.
do the dinner together and celebrate. Yes.
Ah, aha, I see. Yeah, because I was so surprised
Mm-hmm.
when somebody informed me that Christmas Day is like a
Yeah.
couple's day.
Yeah.
So,
Kinda.
wow, really?
Yeah.
So, oh, okay. I thought it's also a family day in Korea,
Yeah.
but
Yeah.
I was wrong.
Oh,
Okay. Well, anyway, I sure hope that all of your plans for this year will definitely be accomplished.
thank you.
Okay, you're welcome. All right. So, what do you want to talk about for? What do you want to do in our class today?
Mm, since I'm gonna having an English interview next week,
Mhm.
so yeah, I just wanna speak in English. Yes.
Ah. Uh huh. Oh, if you don't mind me asking, what is the interview for? Is it for a job or for maybe?
Yes, it is a
Oh.
job interview,
Mhm.
and yeah, of course they do not ask me some too hard question,
Mhm.
but I should prepare for that. So
Mm.
now I am just trying to speak as much as possible I can.
Okay,
Yes.
I see. Yes, and it's a good practice because you want to meet other teachers as well, so you
Yeah,
will get
yeah,
used
sure.
to speaking with, other people, new faces.
Yeah, today I met two new teachers.
Whoa, that's
Yeah.
good. Okay, I
Yeah.
think you're starting this year right.
Yeah.
Okay. All right then. So maybe we'll just have free talking class. So
Mhm.
yeah, but I'm kind of. So would you please tell me more about yourself then, Gia?
Okay. I am now working as a registered nurse, and I already worked with this job for like no, about 7 years. And now I am losing interest about my job. So
Mhm.
I am trying to have a new job. Yes, so these days I'm really struggle for that. So yeah, I finally got some chances of having some interview with new companies. So I am preparing for that. Yes.
Oh, you said that you were not losing interest in your recent job.
Yeah.
What's yeah? So you decided to change career.
Yeah.
Will it be the same work, or is it a different field or
It is
discipline?
in different field, but it requires the nurse license. So yeah, it is kind of it has some common point.
Mm-hmm.
Yes.
So I guess you're a nurse then, right?
Yes, right.
Oh, so how is it go? So how is it going? Being a nurse.
Being in Korea,
Mhm.
first we need to have a degree in nursing,
Mhm.
at least 4 years. And after graduate from school, we gotta take an examination for getting a license.
Mhm.
So yeah, and finally, if someone finally get the license, we can how can I say it? Um, we can apply a job to the hospital.
Mhm.
Yes, that is a procedure of being a nurse in my country. So yeah, and so I'm graduate from college in 2013.
Mhm.
So now is seventh year for me working as a nurse.
Oh, wow. So could you please tell me more about your experience in that hospital? I mean, you
Okay.
have been working there for 7 years. So what are some of the most difficult times you've
Hmm.
ever had, and how did you deal with that?
Oh. Ironically, the most irritating to me is human problem. Like, currently, I am working in emergency department, and
Mhm.
every patient there are so sensitive. They are really, really sensitive. So, every doctor and nurses are also become sensitive because they have too many things to handle, and every patient is thinking like they are the priority. Yes,
Mhm.
so yeah, I can most of thing that I can hear while working is shouting or yeah, some angry talk. So yeah, those kind of environment really drives me crazy. So yeah, so I am feeling my personality is a little bit changing. Like in the past, I was a really active person. I enjoy doing something. I enjoy traveling, and I also enjoy meeting new people. But these days, I have a kind of fear of meeting new people.
Mhm.
So yeah, I just want to stop. Like, I just at first I didn't notice it. Like I just thought this is because I'm getting older. So that is why I have a fear of meeting new people. But I realized this is because of my working. Because um human, as I said, because humans are the main reason of me to get a stress, to get a pressure. So yeah,
Mhm.
so I
Oh.
really don't want to include myself in this kind of environment anymore.
Mhm. So
Yes.
it's getting stressful for you. That is one of the reasons I did not study. I did not pursue nursing.
Yeah. Yes.
But it's good for you that you were able to realize that, and I
Yeah.
sure hope that your next job will be a lot better. I mean,
Yeah.
emergency room is
Yes.
the worst department.
Yeah.
Hmm. Oh, but what are some good stuff that you have experienced when you were working as a nurse in the
Mm.
hospital? Good times of being a nurse.
Yes, of course, there are so many things, so many advantages of working as a nurse.
Mhm.
Like, I can help a lot of help people who needs help, and also I become really happy when I see my patients is getting better.
Mhm.
Yes, and another good thing is I can get discount when I have an um when I have a check in my
Mhm.
hospital.
Mhm.
And my parents and my sister also can get 50% discount in my hospital. That is
Mhm.
very big advantage.
Mhm. Oh yeah,
Yeah,
definitely. I mean, when it comes to health, it's very expensive, and most of the times
you're
we
right.
even ignore them because we are thinking about the
Yeah, right.
expenses, right?
Right.
Well, that's a good thing then. Oh, so um, so for your next career, what's your target then? So you since you're going to shift, you're going to work in another environment. So
Mm-hmm.
is does that mean that you're going to work in a private company as a private nurse or still
Oh,
in another hospital?
um, actually, it is not in the hospital. It is a job that, like, before we use a medicine, we need
Mhm.
to do the study. Like, we need to do the
Mhm.
clinical trial. So
Mhm.
I will be whatever steps in that study. And so what I am gonna do there is like I need to check the procedure of. It's pretty hard to describe. Like there is a new medicine,
Mhm.
and um we are gonna bring some people that who have who want to take this new study.
Mhm.
Yes. So we are gonna give them a new medicine, and we need to record every reactions and um yes, after
Ooh.
having that medicine,
Mhm.
so that
Ah.
this medic this medicine is um good or not.
Mhm.
Yes.
So before that medicine is going to be released to the market, you
Yes.
are going to be involved in a research. So
Yeah.
maybe
Right.
you're going to, yeah.
That is correct.
So you will be, wow, so you'll become a researcher. And I
Yeah.
think
Kind
that
of.
that is even way maybe easier, a
Yeah.
lot less
Sure.
stressful.
Yes.
Hmm.
And I don't need to meet
Uh-huh.
that so many people. I don't need to meet so many people.
Mhm.
Yes.
Mm. Yes.
Yeah.
And I don't think that those samples, the sample or mean the participants,
Mm-hmm.
right,
Yeah.
will go there and be angry at you because
Yeah.
they, I think they voluntarily participate in that. So I guess it would be fun for you. Not really
Yeah.
fun, but it's less stressful. Oh,
Yeah.
that's good.
Yes.
So you're going to participate in that, and I sure hope that you will definitely ace the interview.
Mm-hmm. Thank you.
Yeah. Hmm. Oh, is one of the reasons why you want to participate in that, is it because also of your English skill? I
Mm-hmm.
mean, it's a research, so it's going to maybe published in English as well,
Mm.
right?
Oh yes, and we are also gonna do some global study. Yes. So if I do that, I need to work with foreigner staff. Yeah, in that case, English
Uh-huh.
is necessary.
So it's not only in Korea, but you will also take samples maybe or from other countries as well?
Yes, and we have two types of company, like local company and global company.
Mm.
So yeah, as a beginner, I need to work in local company first, but
Mhm.
becoming like um how can I say it, perfectionist in this area,
Mhm. Mhm.
I
Maybe.
can work in global company.
Ah.
Yes.
Okay. All right. So once you will, you will get the hang of working in that company. Maybe you can apply for maybe a
Yeah.
promotion, or you
Yeah. Right.
can be transferred to the global company and deal with
Yes.
foreigners as well.
Yeah.
Woo!
Right.
Wow, very interesting plan, Gia. I will root for your success
Oh, thank you.
in that one. 7 years. It's time for you to find a job that you will have fun with.
Yeah.
Ah, okay. But you are still working in the hospital right now, right?
Yes,
Ah,
I'm gonna quit
mm-hmm.
um probably this month or next month.
Next month.
Yeah.
Ah, all right then. So what about after? So after that,
Mm-hmm.
what happens? You're going to
Mm-hmm.
work immediately? be in that company?
Um, Actually, I already have one company which hired me,
Mhm.
but the distance is pretty long from my place,
Oh.
so I am
Mhm.
considering not to go there. Like
Mhm.
it takes about 2 hours to get there, so the total will be 4 hours. So I need to spend 4 hours for a date for commute.
Mhm. Mhm.
So that is why I'm considering not to go there. But they want me to work as soon as possible.
Mhm.
So yeah, if I work
Mm.
there, I need to work right after quitting. Yeah,
Mm.
so yeah, I think it will depends on the result of my next interview.
Mm. I see. Yes. And since they want you to work immediately, are there any kinds of, maybe are they not going to maybe offer at least accommodation
Yeah.
for you? No? Ooh. See? Somebody's interested.
Yeah.
Wow. So I sure hope that you will pass that interview,
Mm.
and oh, I will. I'm sure that you're going to ace that one. I'm pretty sure about that.
Thank
Are
you.
you confident too?
Thank you.
Mhm. You're welcome. Wow. So anything else? But
Uh,
what makes you worry? What are some things that worries you a lot about your interview? Are there any things that worry you about the interview?
yeah, because I this is my new trial. I have no career in this area, so if the interviewee asks me some tricky question, I won't be
Mm.
able to speak properly. I won't be able to answer properly. So, in that case, they are not gonna hire me.
Mhm.
So I need to study before having an interview. But um, I just have 4 days before that day, so I don't believe I can be perfect. So that
Well,
is
no.
what I'm
Mhm.
worrying now.
Well, don't worry, Jihan. Nobody's perfect, but I think you can do it. Okay? Yeah, be more positive. Ah, yeah.
Yeah.
Okay. It's okay to worry, but I think that, you can do it. I
Mhm.
believe. You believe in yourself, okay?
Thank you.
Okay. All right. So, anything else you want to tell me before we'll end the class?
I just wanna say thank you for rating me, and I really appreciate that you listen to my situation. Yeah, I
It's
just wanna say thank you to you.
No, no need for that. It's a pleasure. I mean, it's nice to meet someone in the medical field. And, you know, I am planning to go to medical school, and I believe that without nurses, actually, there are no
Mm.
doctors, right?
Oh, yeah,
You
right.
nurses are the right hands of the
Yeah,
doctors.
right.
So I hope that you will definitely find that job that you would really love and have
Uh,
fun there.
Thank
Okay?
you.
Okay. Good luck in your job interview, Jihe. Bye
Okay,
bye.
have a great night.